Welcome, and today we'll be learning about hip dysplasia in dogs. This condition is a common problem, especially in larger breeds. It affects the hip joint, which can lead to pain and mobility issues. Let's dive in and understand the hip dysplasia and how it can be managed to help our furry friends live healthier lives. Hip dysplasia is a skeletal condition where the hip joint doesn't fit together properly. This can cause the joint to be unstable and could lead to pain. We'll often hear terms of osteo referring to bone or itis, meaning inflammation. In hip dysplasia, the inflammation and the joints can make it difficult for dogs to move comfortably. This condition can be acute, meaning it comes on suddenly in younger dogs, or chronic, meaning it develops over time as the dog ages. Anatomy of the hip joints. Let's take a closer look at the hip joint. The femur or high bone has two key points: the diaphysis, which is the shaft, and the epiphysis, the round end that connects with the pelvis. The hip joint is critical for movements and stability. The bone in this area needs to work together smoothly to allow your dog to rock, run, and jump. Acute versus chronic condition. Hip dysplasia can be either acute or chronic. Acute hip dysplasia often shows up suddenly in younger dogs, especially if they are a genetic predisposition. Chronic hip dysplasia develops more slowly over time and is commonly seen in older dogs, often causing osteoarthritis. As your dog ages, the joint may wear down, leading to discomfort and pain. The importance of this discussion in hip dysplasia is particularly common in larger breeds like German Shepherds. It can cause severe pain and limit your dog's mobility. Early diagnosis is necessary as it can help improve your dog's quality of life. The earlier the condition is identified, the more options we have for managing it. Of recognizing hip dysplasia. So, how can we tell if your dog might have hip dysplasia? Watch for signs like difficulty getting up or climbing stairs, or bunny hopping gait where both hind legs move together, muscle atrophy, or a weakening of muscles, especially in the hind limbs, is also a red flag. If you notice any of these, it is important to consult your vet. Now let's take a look at inflammation and diagnosis. When the hip joint is inflamed, it can swell, feel hot to touch, and cause limping and lameness. To diagnose hip dysplasia, veterinarians use radiographs or x-rays to get a clear picture of the joint. Sometimes CT scans are used to give a more detailed view of the joint and surrounding tissues. This tool helps veterinarians assess the extent of the condition. Management and prevention. Managing hip dysplasia often involves weight control to reduce stress on the hips. Physical therapy is important, strength and mobility, and medications to relieve pain. In some cases, surgery may be necessary, including a total hip replacement. Prevention focuses on responsibility breeding practices and early scannings, which can help identify hip dysplasia in puppies before it becomes a serious issue. In conclusion, hip dysplasia is a medical condition, especially when caught early with the right care. Many dogs can continue to live active and happy lives. If you notice any signs of discomfort or abnormal movement, make sure to schedule vet visits. Regular checkups and early diagnosis are key to ensuring your dogs stay healthy and mobile. For more information, you can refer to the trusted resources like the Merck Veterinary Manual or Veterinary Clinic of North America. These resources provide in depth information about the diagnosis and treatment of hip dysplasia. Thank you.